we have a clear picture how globally COVID pandemic has affected breast cancer screening. It has affected in two ways. One is the hospital resources. Because of the stress and strain on the hospital resources globally, the screening programs have had a major setback all over the world because they were not the priority settings. The focus was on the treatment of cancers. So majority of the countries, especially Europe and North America, breast cancer screening was grossly affected. A lot of patients could not turn up, nor the facilities were available at the time of screening. So we don't have the real figures as of now, how it has affected and what is the impact. But now we have clear picture that majority of the screening programs globally were affected due to the stress and strain on the healthcare system. Second, the patients were not able to come forward for screening programs like mammography because of the fear of COVID, elderly patients. So they were, and due to lockdowns, so they could not come forward. So to summarize, I think COVID has definitely affected screening programs globally. Now with the gaining control over COVID slowly with the vaccines and other developments, the screening programs will see a big number of patients, a backlog coming for screening of breast cancer in the future. Here I think we can discuss the current modalities and what are the emerging modalities for breast cancer screening. The standard modalities as of now globally, time-tested methods of screening mammography, breast self-examination and clinical examination by trained healthcare worker. Okay. So, but we have a lot of drawbacks with these conventional methods. So that is why research is going on to come out with better technologies, more user-friendly technologies, and the point-of-care technologies which are portable, which are simple. So, if you look at these emerging technologies, we have a lot of innovations on the platforms of the existing imaging modalities. Starting from ultrasound, now we have a contrast-enhanced ultrasound, we have a elastography. Then we have advanced mammography technologies which are coming like digital tomosynthesis, and we also have computer-aided programs for artificial intelligence based programs for detection of breast cancer, especially on CT scans and mammographies, and we have advanced perfusion MRI scans coming for detection of early breast cancer in patients with high risk of breast cancer. Apart from that, there are also advances which have taken place in the field of PET scan. PET mammography is also coming as a screening tool, and there are a lot of new technologies which are being explored. Currently, I would say they are investigational. So that include the molecular and genetic based technologies. So genetic testing is now proven value, but not in all breast cancer patients, but in 10% of breast cancer patients where there is a strong family history, you can do a simple genetic test and can screen for breast cancer risk or for risk of development of breast or ovarian cancer. That is genetic testing. Then we have a lot of molecular testing which are still investigational. Then we have novel technologies like thermography, spectroscopy. So these are all would like to actually characterize the type of breast tissue and what the kind of changes that have taken place in early sort of a stage breast cancer, and they can give you a hint that there may be a early stage breast cancer in a patient. So but I would say all these technologies are still investigational. Coming to other technologies of breast cancer which you are trying to learn is navigation. I think that is another important area, if not for screening, but it is playing a very big role in the management of breast cancer, especially early breast cancers. So here I would like to highlight the role of fluorescence imaging, which is a very novel sort of a surgical technology. It is a real game changer. It is playing a big role in helping surgeons for the navigation during surgery, so that they can identify the critical structures which are very helpful on the table while operating. So this technology will help you to identify the critical structures, save them, and at the same time precisely remove the cancer part. So this is called a fluorescence based imaging. So this imaging plays a very major role in the area of breast cancer, especially early breast cancer, when you are doing new procedures like sentinel lymph node biopsy, breast conservation surgery, breast reconstruction. It will also give you an indication what is the kind of perfusion, how much is the blood flow in the tissues at the time of surgery. So it is a real-time technology a big game changer, helping the surgeons on the operating table. So since till now we did not have that kind of technology available, so most of the time we investigate the patient, take them to operation theatre, then entire surgery is performed based on the surgeon's assessment. But we have a real-time technologies which are available, that is fluorescence imaging based technologies. So that are now that is available for routine clinical practice in India, at our center also, and all over the world. This is an important sort of a topic, because you see 90% of the time breast cancers, nobody knows the exact cause of breast cancer. Okay, so 10% can be related to the strong family history or problems in the genes. These are genetic or hereditary cancers, what we call. In the 90% of the breast cancer patients, what we normally, the evidence which is available is actually telling that the lifestyles are playing a big role in causation of breast cancer. So what are these lifestyle factors? So these are all based on the epidemiological research and the current trends of cancer. So in the lifestyle factors, if you look at that includes the kind of lifestyle you lead, the physical activity, the kind of diet you consume, and the personal life choices, including marriage, childbirth. So a lot of these factors can influence. For example, let us look at the adverse lifestyles which can increase the breast cancer. That includes the obesity, okay, lack of physical activity, and consuming fast foods, high calorie foods, and you also have a high risk in patients who are marrying late, okay, after the age of 30, less number of children, okay, if you are not breastfeeding the children. All this will actually affect your hormonal system in the body, leading to hyperestrogenism, and that can cause breast cancer. Okay, so these are certain lifestyle factors we have to keep in mind if you want to deal with breast cancer. There are certain things which are there in your hand, which you can control, and there are certain things which are beyond your scope of management, okay, like genetic factors. They're not in your hand. So that is the fates, just the simple fate, what kind of genes you inherit from your parents or your family. So that is not in your hand. But there are certain factors which are definitely you can control, you can modify, and you can improve your health outcomes. So from breast cancer point of view, these things include a healthy lifestyle. What do you mean a healthy lifestyle? It's a very loose term, but it's just a sort of a lifestyle which highlights a balanced lifestyle, a healthy lifestyle where you have a good physical activity, okay, a good balanced diet, which includes a good portion of vegetables and fruits in your diet, less fatty diets, low amount of red meats, okay, more fruits, more vegetables, a lot of liquids, a good hydration, okay, and a good sort of healthy lifestyle, and your awareness for detection of these cancers. Awareness is very important, so that should be inculcated as a sort of a habit. So you should know about your body, you should know about your breasts, so that if there is the earliest sign of any abnormality or anything which is not usual, you should be able to go to the doctor and consult them for an early diagnosis. So that is what I call awareness about your health status, about your cancers, about your normal body, to be aware. Okay, don't neglect your body, or because the body always gives some early warning signs. So you should be able to pick those signs. So for example, in the breast cancer, so any breast lump which is not resolving within a 2-3 weeks time, okay, which is growing in size, or any nipple discharge which is blood stained, these are certain early signs. You should be careful and should report to the doctor as soon as possible, so that the cancer can be picked up at early stage. If it can be picked up at early stage, 90% of the breast cancers are curable. So that is the best part of it. 90% of the early stage breast cancers are curable in the current era. So this is a sort of a set of lifestyle factors which include the diet, physical activity, your lifestyle patterns, your choice about your marriage, children, timing of that, these events, And of course, last but not the least is the awareness about your health, awareness about your breast health, and seeking for early medical diagnosis and interventions. Thank you.